Officer within the Center for Devices and Radiological Health. I have held various positions within the center, including being a pre-market reviewer within the Office of Device Evaluation. During today's presentation, we're going to cover the fundamentals of the 510K program. A 510K, which is also referred to as a pre-market notification, is one of the major pathways for bringing a device to market. Actually, the 510K is the most common pre-market submission for medical devices. During today's presentation, we are going to cover the following learning objectives. I'm going to provide you with an understanding of medical device classifications and how classifications apply to 510Ks. We're going to cover what is a 510K and when it is required and the different types of 510K submissions. We're going to talk about what should be included in your 510K, the actual content, and what should be submitted to the FDA. We're also going to talk about the 510K submission process and the timeline on how and when the FDA will communicate with you during the review of your 510K. And lastly, we're going to cover what are 510K decisions and what they mean. So let's begin. Let's talk about device classification as it relates to 510Ks. The FDA regulates medical devices based on risk. Class 1 devices are considered low-risk devices. These devices are subject to general controls. Most, but not all Class 1 devices are exempt from the pre-market notification process. Class 2 devices, which are considered moderate-risk devices, are subject to general and special controls. Most, but not all Class 2 devices require a pre-market notification. This is going to be the topic of our presentation today mostly. Now, Class 3 devices are considered high-risk devices, and these are subject to general controls and pre-market approval. Most product codes are found on all 510K clearance letters. This can be extremely useful to you as you can search for relevant products that have similar product codes. Within this slide, I've provided you references to the guidance document on medical device classification product codes, which provides you additional information on what product codes are and how they can be used. As well as my favorite reference is the product classification database. This database can be extremely useful. It is a public database and it provides you a wealth of information on the appropriate regulatory pathway for different devices. On this slide, I have provided you an example from the product classification database. This example is for an infusion pump, and as you can see, this is an output from the product classification database which lists a whole bunch of information, including that 3-letter product code FRN. And what's even more useful is that it specifically outlines the submission type on the product classification. So here, as you can see where the blue arrow is pointed, the submission type is for a 510K. So for an infusion pump, you would submit a 510K for this type of product. So what do you do if you can't determine the appropriate device classification? So you've done your due diligence and you've looked in the product classification database, but you're still unable to determine the appropriate classification for your product. You may want to consider the 513G program. The 513G program is a request for information to the FDA. The FDA will respond by providing you what they think is the appropriate regulatory pathway for your device. There are a few caveats to the 510K or 513G program that I'd like to provide you. There is a 513G user fee, so please keep that in mind when you are preparing to submit the 513G. FDA responses to 513Gs do not constitute FDA clearance or approval. So if you submit your 513G and the FDA responds with the appropriate regulatory pathway, you still must comply with that pathway, such as the submission of a 510K or the submission of a pre-market approval application. On this slide, I've provided you references to the 513G program and the user fees associated, and please refer to those for additional information. So next, let's talk about the actual 510K program. So let's first talk about what a 510K is. As I had mentioned before, a 510K is also referred to as a pre-market notification. The reason why a pre-market notification is also referred to as a 510K is because it actually refers to the section 510K of the Federal Food, Drug, and Cosmetic Act. So that is why people often say 510K and pre-market notification interchangeably. Within 21 CFR, which stands for Code of Federal Regulations, 807 subpart E, this actually outlines the information that is required in the submission of your 510K. A 510K is considered a marketing clearance application, therefore the FDA clears 510Ks. The clearance is based on the determination of substantial equivalence. Now, on the contrary, a 510K is not just a form. A 510K can be an entire submission that can be hundreds of pages long. It all depends on the device and what needs to be submitted to demonstrate substantial equivalence. A 510K is also not establishment registration or device listing, and a 510K is not a pre-market approval. Therefore, it is inappropriate to say that FDA has cleared your 510K and therefore your product is FDA approved. Only products or devices that are approved through the pre-market approval process are considered FDA approved. So keep in mind that a 510K receives FDA clearance and therefore it is FDA cleared. So now let's talk about substantial equivalence. This is the bread and butter of the 510K program. Substantial equivalence is basically the demonstration that your new device compared to a predicate device has the same intended use and the same technological characteristics, or it has the same intended use and the differences in technological characteristics do not raise different questions about safety and effectiveness. It's very important to note that substantial equivalence is the whole point of the 510K program, and that's what you are trying to demonstrate in your submission. So what is a predicate device? You are demonstrating substantial equivalence. So you have your new device and a predicate device. The predicate device is actually a legally marketed device that is typically cleared through the 510K process. And this is used for comparison of your device, the new device, to the predicate device. And this is the premise of substantial equivalence. On this slide, I've provided you multiple references to the 510K program. Specifically, I want to draw your attention to the final guidance, the 510K program, which is titled Evaluating Substantial Equivalence and Pre-Market Notification. This is an extremely important guidance document for anyone who's participating in the 510K program, and I recommend that you take the time to review this guidance thoroughly. I will be referring to this guidance throughout the rest of this presentation, so please make a note of the link to this guidance. Additionally, there was a public CDRH Learn webinar, which provides additional information as well. And then the link at the bottom on how to find and effectively use predicate devices is also helpful. So the 510K decision-making flowchart. I don't expect you to be able to read this flowchart right now. We'll go over the decision points in the next slide. But take your attention to Appendix A of that 510K guidance document that I referred to on the previous slide. This decision-making flowchart is what you should be referring to when you're demonstrating your substantial equivalence. So let's go through each of those decision points. So this is what the pre-market reviewers are going to be looking at when they look at your 510K submission to make sure that you're following through the flowchart and demonstrating substantial equivalence. The first point, or decision point, is the predicate device legally marketed? Therefore, has the predicate device received the appropriate clearance or approval as necessary? The second decision point is, do the devices have the same intended use? This is very important because it's going to be difficult for you to demonstrate substantial equivalence to a predicate device that has a different intended use. The third decision point is, do the devices have the same technological characteristics? And if they do not have the same technological characteristics and they raise different questions of safety and effectiveness, then you're going to move through decision points 4 and 5. If there are differences, again, in decision point 5, it's 2 parts. You're going to provide the methods acceptable for your performance testing to demonstrate substantial equivalence, and you're going to provide the data that is used to demonstrate that substantial equivalence. So the reviewer is going to look to make sure that you've addressed these decision points. So please take the time to review the flowchart and make sure that your 510K submission provides the information necessary. So when is a 510K typically required? A 510K is typically required in 3 scenarios. The first is if you're introducing a new device to the market for the first time. The second could be changing the indications for use of a previously cleared device. And the third could be making significant modifications to a previously cleared device. In these situations, this is when a 510K would be required, and you would require 510K clearance before you could market the product. On this slide, I provided references. One of the main questions that we receive is, you've made changes to your product and whether or not it requires the submission of a new 510K. So if you have questions on whether or not you've made a modification to existing device, please refer to the following references. So there are 3 types of 510K submissions. There is a traditional 510K, an abbreviated 510K, and a special 510K. We're going to go through each one specifically. For a traditional 510K, you must submit the required elements of 21 CFR 807.87. These are typically the administrative requirements such as the business name, the trade name, things like that. The traditional 510K relies on the demonstration of substantial equivalence. It's important to note that a traditional 510K can be used under any circumstance. The abbreviated and special 510K can only be used if certain criteria are met. An abbreviated 510K must also include the required elements of 21 CFR 807.87, But an abbreviated 510K relies on the use of guidance documents, special controls, and recognized standards. Under certain conditions, sponsors may not need to submit test data in an abbreviated 510K because you are following the FDA recommendations in guidance documents or recognized consensus standards. So that's when an abbreviated 510K may be appropriate. A special 510K must also include the required elements of 21 CFR 807.87. However, a special 510K is appropriate when you are making device modifications to a manufacturer's own legally marketed device. Therefore, you're making modifications to your own product, so you own the predicate device. It's important to note also, though, for a special 510K to be appropriate, the modification may not affect the intended use or fundamental scientific technology of the device. Because the reason for this is that data is not typically submitted with a 510K or special 510K. On this slide, I've also provided you with some additional references on how to prepare a traditional, abbreviated, and special 510K, as well as a 510K screening checklist and a link to the appropriate 510K forms. So what do you do if you have a low or moderate risk device with no identifiable predicate device? So you've taken the time and done your due diligence and you're unable to identify an appropriate predicate device. You may want to consider a de novo. For more information on the de novo program, please refer to other modules within CDRH Learn. Next, let's talk about the content of a 510K and what should be submitted in your 510K. On this slide, I have provided you with various bullets on what should be included in the content of your 510K. There are various administrative requirements, certain forms, and cover letters, but specifically during this talk, we're going to go over the highlighted aspects in more detail. So let's first start off by talking about the intended use and the indications for use. The intended use is the general purpose of the device or its function and encompasses the indications for use. So the intended use is the broad term, and indications for use is encompassed within the intended use. The indications for use actually goes into more detail and describes the disease or condition the device will diagnose, treat, prevent, cure, or mitigate, including a description of the patient population for which the device is intended. You want to make sure that your intended use and indications for use is consistent throughout your 510K. Make sure that they're both the same in your indications for use statement, your proposed labeling, your instructions for use, etc. There is a recommended format for your indications for use statement. Please refer to Form FDA 3881. And when you submit that form, make sure that you identify whether or not your product is considered prescription use or over-the-counter. The next aspect of your content of your 510K should be your 510K summary. The 510K summary is a high-level discussion of the content within your 510K. Within your 510K summary, you should cover the elements covered in 21 CFR 807.92. Your 510K summary should include sufficient detail to provide an understanding of the basis for your determination of substantial equivalence. During the review of your 510K, the FDA will verify the accuracy and completeness of your 510K summary. For more information on what should be included in a 510K summary, please refer to that final guidance, the 510K program, specifically Appendix B, which covers the 510K summary document requirements, as well as provides a great example of a complete 510K summary. Next, let's talk about FDA-recognized consensus standards. This is a voluntary program and is used to simplify and streamline the 510K review process. Sponsors can declare conformance to consensus standards in order to help their review process. Sponsors should document the extent of their conformance in their 510K application via the Form FDA 3654. If you have additional questions regarding the standards program, please refer to the following guidance. As well as there is a public recognized consensus standards database, which you can search for FDA recognized consensus standards. FDA guidance documents. This is very important to understand because FDA guidance documents actually represent FDA's current thinking on a topic. FDA guidance documents can be device specific or they can be general and apply to multiple different devices. However, guidance documents do not create or confer any rights for or on any person and do not bind the FDA or the public. So really the guidance documents provide FDA's current understanding or current thinking. Alternative approaches may be used that are outside of the guidance documents if those approaches satisfy the requirements of the applicable statutes and regulations. There is a public FDA guidance document database, which you can search for FDA guidance documents. I want to recap and go back to that product classification database, which I told you I think is an invaluable tool. On the bottom of that product classification for the infusion pump, under the product code FRN, was also listed these FDA recognized consensus standards and guidance documents. As you can see, they are specific to infusion pumps, so you can refer to them if you are developing a 510(k) submission for infusion pumps. It can be extremely helpful, and please refer to the product classification database to get this additional information. Next, within your 510(k), you should make sure you include a detailed device description. Within your 510(k), you want to include the description of the device design, including anything that you think is important for the reviewer to be able to understand the intended use and the purpose of your product. You can include anything from figures to diagrams, anything which would be helpful to describe your device. Additionally, you want to include a listing of materials, specifically the patient contacting materials, because that will indicate what types of biocompatibility testing would be appropriate. Additionally, within your device description, you want to include energy sources, such as battery or AC power, and you also want to include any key technological features. Within your 510(k), you also want to include a detailed substantial equivalence discussion. The substantial equivalence discussion is the foundation of your 510(k), so please refer back to the 510(k) decision-making flowchart and go through each of those decision points so that you are clear and the reviewer is clear as to how you are demonstrating substantial equivalence. The 510(k) review standard is, again, it's comparative, so you're comparing your new device to your predicate device. Within the 510(k) program final guidance, it addresses some specific points that I wanted to make note of during this presentation. The first one is that multiple predicate devices are okay, but only under certain circumstances. So for additional references or examples on when a multiple predicates may be appropriate, please refer to that guidance. It's important to note that split predicates are inconsistent with the 510(k) regulatory standard. And lastly, within the guidance, it addresses a new term called reference devices. Reference devices may be used to support scientific methodology or standard reference values. Reference devices are not predicate devices. Therefore, reference devices typically won't come into your 510(k) until around decision point 4. So please keep that in mind when you're providing your substantial equivalence discussion. Within your 510(k), you should provide your proposed labeling for your device. Your device labeling should comply with the requirements of 21 CFR 801. Copies of all your proposed labeling are recommended, including your package insert, service manuals, instructions for use, advertising, and/or promotional materials. The directions for use should include your specific intended use statement and any warnings or contraindications or limitations for your device. Your labeling in your 510(k) should be submitted as a final draft. Copies of your predicate device's labeling is recommended, but it's not required. If you have additional questions or need further clarification, please refer to the Introduction to Medical Device Labeling as the link provided on this slide. Next, we're going to talk about performance testing. Performance testing can be bench, animal, or clinical. Performance testing is actually determined specifically to the complexity of your device and its intended use. So every 510(k) is going to have different performance testing, depending upon the difference in the technological characteristics or the differences in the new device compared to the predicate. I recommend that you consider FDA guidance documents, especially the device-specific guidance documents, which may provide recommendations on appropriate performance testing. You may consider comparative testing to demonstrate substantial equivalence, which could be side-by-side comparison testing of your device compared to the predicate, but that's not required. So if you are unable to obtain the actual predicate device, consider comparative testing in the sense of a table which outlines the comparison of the two different specifications and their intended use, etc. Within your performance testing, you should include your test methods, your acceptance criteria, and your test results for review. I want to make a specific note on performance testing, clinical performance testing. Clinical testing is most often not required for 510(k) submissions. However, clinical data may be requested in the following situations. When you have a new or modified indications for use, clinical testing may be needed. If you're making significant technological changes, that may also require new clinical data. Or when non-clinical testing methods are limited or inappropriate because of the indications for use or device technology. Please refer to the 510(k) program final guidance for additional examples and explanation on when clinical data may be appropriate. So when we're talking about the content of 510(k), just to wrap up with some key considerations, So make sure your information is complete and organized. Make sure your 510K is organized. Include a table of contents. Make sure you use tabs and paginate appropriately. If you can, use tables and graphs. This can be extremely helpful for the reviewer during their review. And use visual aids whenever possible. Within your 510K, you want to make sure that you clearly identify basic 510K requirements, such as the 510K summary or the indications for use form. And make sure that you're consistent throughout your 510K submission. As we mentioned earlier about the intended use and indications for use, make sure that they are consistent throughout your 510K. And again, please follow any applicable guidance documents or device-specific checklists. They're there to help you prepare your 510K. On this slide, you have some references to the content of a 510K as well as some 510K formatting tips. Please refer to those for additional information. So lastly, I want to talk about for the content of the 510K, I want to provide you with some information regarding the pre-submission program. There is a guidance document titled Requests for Feedback on Medical Device Submissions, the Pre-Submission Program and Meetings with the Food and Drug Administration staff. This can be a valuable program. It is a way for you to obtain feedback from the FDA before the actual submission of your 510K. But typically, a pre-sub for a 510K is only appropriate for unique situations, such as when you may need clinical data to support your demonstration of substantial equivalence. Through the pre-submission program, you would submit a formal written request to the FDA, and you would request either a formal written response, a meeting, or teleconference to address your concerns. Because this is a formal written request, it is subject to e-copy requirements, which we'll discuss during the submission of a 510K, but it's important to note that they are subject to e-copy. For additional information on the pre-submission program, I have provided you the link to the guidance on this slide, as well as the public CDRH Learn webinar on the pre-submissions and meetings with FDA staff. So now let's talk about the 510K submission process. But before we get into the actual timeline, I wanted to provide you with some important notes before you actually submit your 510K. The first is your submission to the FDA. You must submit 2 copies of your 510K. One of those 2 copies must be submitted in electronic format, or what is also referred to as an e-copy. The FDA does not return your 510K submission after its review, so you will not get back the hard copy. When you mail your 510K, please make sure that you mail it to the appropriate document control center, the address provided on this slide. For additional references, you can refer to our addresses for submissions link that is also provided on this slide. So I referred to the e-copy, and so I'd like to talk about the e-copy program a little bit so you have a better understanding. A valid e-copy is a requirement for pre-market submissions, including the 510K. An e-copy is defined as an exact duplicate of the paper submission. An e-copy is accompanied by a paper copy of the signed cover letter and the complete paper submission. So for your 510K, you will submit 1 electronic copy or e-copy and 1 paper copy. If you have additional questions regarding the requirements of a valid e-copy, please contact our e-copy experts and refer to the e-copy program for medical device submissions website, which provides a great instructional video on the appropriate nomenclature for your submission and things like that. Also, before you submit your 510K, you have to submit your user fee. 510K submissions are subject to user fees. Your user fee must be received on or before the time the application is submitted. FDA will not accept the 510K for filing if the fee is not paid. There is a standard user fee and a small business reduced user fee. If you believe that you are a small business, which makes less than $100 million in sales, you must submit your small business determination qualification first. If you submit the standard 510K user fee and then subsequently later get a small business determination qualification, the FDA will not refund you the difference. So please make sure that if you think you are a small business, that you get your small business determination number first, so that way you are eligible for the reduced fee. On this slide, I've provided you references to 510K review fees, as well as the medical device user fee, small business qualification and certification guidance. So please refer to those if you believe that you are a small business. Next, let's talk about the 510K submission process. The 510K submission process is very important to understand because this is going to be how and when the FDA communicates with you during your review. So that way you are informed and your company is informed as to when your 510K and where your 510K is at. So this timeline has been simplified, and please keep in mind that the days are in calendar days. For the actual content of the 510K submission process, please refer to the 510K submission process website. This website provides the timeline as well as additional links and resources to guidance and other things that help to simplify that timeline. So let's begin with the 510K submission process, the timeline. So day 1 is the day that FDA receives your 510K submission. By day 7, the FDA will either send you an acknowledgement letter or a hold letter. If you receive a hold letter, that means that there are issues with your user fee and or e-copy. So if you receive a hold letter, your 510K will not proceed forward to be accepted for filing until you have resolved the user fee and or e-copy hold issues. By day 15, after your 510K has passed through the user fee and e-copy, the FDA will conduct what's called an acceptance review. By day 15, you will find out from the FDA if your 510K has been accepted for substantive review or if it has been placed on refuse to accept hold. Refuse to accept hold, or the refuse to accept policy, is outlined in the guidance and the link provided on this slide. I recommend that you review that guidance thoroughly. It provides a great checklist so that you can make sure that you're meeting all of the administrative requirements of your 510K. And that's the purpose of the refuse to accept policy, is to make sure that your 510K is administratively complete and that the reviewer can conduct a substantive review. The FDA clock begins on the date receipt of when your 510K is accepted for review. So if your 510K does not pass RTA, the RTA hold, your 510K will be put on hold until you submit the necessary information. By day 60, the FDA will conduct their substantive review. And by day 60, the FDA will communicate with you as to whether or not your 510K is going to proceed through interactive review or they will make an additional information request. So a substantive interaction that they will have with you by day 60, as I mentioned, can be that your 510K will not be placed on hold and the outstanding deficiencies will be resolved via interactive review, or that your 510K will be placed on hold and you will receive a formal additional information request which identifies the outstanding deficiencies that need to be addressed. So let's go into those specifically. So interactive review is an informal interaction between FDA and the submitters during the review of your 510K. Interactive review requests do not stop the FDA clock. So that can be very beneficial because it prevents unnecessary delays, it may reduce the overall time to decision, and it ensures that timely responses from submitters are received. So the reviewer will determine whether or not interactive review is appropriate. Please note, though, that interactive review correspondence is not subject to e-copy requirements unless you submit information that is needed for the interactive review through the Document Control Center. So anything that is submitted to the Document Control Center must have a valid e-copy. Additional information requests are formal requests. Additional information requests are made via email. However, that does not stop the reviewer from contacting the 510K submitter to discuss the deficiencies in detail. However, the reviewer will follow up with a formal email to place that submission on hold. So additional information requests are formal and they are subject to e-copy requirements. Because they are formal, they do stop the FDA clock. So a company or a 510K submitter has up to 180 days to provide a complete response to the AI request to the Document Control Center. It's important that you note that you have 180 days to respond. If you submit your file on day 179 and you do not pass the e-copy requirements, your file may go over 180 days and your 510K may be withdrawn. So please account for that when you're preparing your response to your additional information. So next, by day 90, FDA will hopefully issue a MDUFA decision on your 510K. MDUFA 3 performance goals are for a traditional and abbreviated 510K 90 FDA review days, and for a special, it's 30 days. If you do not receive a MDUFA decision by day 90, the FDA will communicate with you via a missed MDUFA decision communication by day 100. And this communication will outline the outstanding review issues with your 510K. So now let's talk about 510K decisions. 510K decisions, you can receive a substantially equivalent decision or a non-substantially equivalent decision. If you receive a substantially equivalent decision, you can then market your product. You have received 510K clearance. It's important to note, though, that once you receive 510K clearance, you now have a valid 510K number, and you should complete your establishment registration and device listing. Please refer to the other modules on CDRH Learn for additional information on how to comply with registration and listing requirements. If you receive an NSE or a non-substantially equivalent decision, you may have to resubmit another 510K with new data. You may be appropriate for you to submit a PMA, a de novo, or a reclassification petition. So why might you receive an NSE decision? The first reason may be that you don't identify an appropriate predicate device. So either your predicate device was not legally marketed or it's not appropriate. And it could be that your predicate device has a new intended use compared to your predicate device. Or you may receive an NSC because the differences in technological characteristics compared to the predicate device do raise different questions regarding safety and effectiveness. You may also receive an NSC decision if you did not demonstrate that your device is at least as safe and as effective as your predicate. So really you want to make sure in your 510K that you go through the substantial equivalence discussion and make sure that you're addressing the decision points within the flowchart. So what happens after a device is cleared? The following are posted on the FDA's public 510K database: your substantial equivalence determination letter, your indications for use form, and a 510K summary if one is provided, or if you have provided the 510K statement instead. Please note, for 510K statement, submitters must make available all information included in their pre-market notification on safety and effectiveness within 30 days of a request by any person. In summary, we have covered a lot of aspects regarding the 510K program during this presentation. We've covered the fact that the appropriate classification for a device will indicate whether or not 510K clearance is required before the device can be legally marketed. We've gone over that the 510K review standard is comparative. Therefore, substantial equivalence must be demonstrated for a new device compared to a legally marketed predicate device. We also covered in depth what type of content should be included in your 510K to demonstrate the safety and effectiveness of the new device compared to the predicate device. And we went over the timeline for which the FDA will communicate with submitters during the review of their 510Ks. And we talked about 510K decisions, and if a 510K is found substantially equivalent, that it can be legally marketed in the United States. This slide provides you with additional resources for obtaining information about medical device regulation, so please refer to them if you need additional assistance. I hope that this presentation has been able to provide you with the fundamentals of the 510K program, and thank you for watching.